Goeiedag, good day, fellow South Africans and citizens of the world. Well, it was just a couple of days ago. I was speaking to Rob regarding the National Health Insurance Scheme and whether this was just another way to loot and plunder the private health insurance schemes. And of course the answer was, of course it is. Well, now it comes out that the disgraced ex-health minister Zweli Mkhize signed a new act into Parliament just before he was summarily pushed aside for being involved in corruption. Par for the course with the ANC. Now, this is what is happening with the NHI or the National Health Insurance Scheme. Let me tell you. Trade Union Solidarity says it will strongly oppose proposed regulations that pave the way for the implementation of the so-called Certificate of Need for healthcare practitioners. Now, I will put a copy of this document linked below this video so you can actually go and have a look at the bill that Zweli Mkhize famously signed into law just before he left. This act, or this move by Solidarity, follows after the proposed regulations were published in the Government Gazette for comment in June 2021. Now, let's remember that, again, just 2 nights ago, I spoke to Werner Human, who is the COO of Solidarity, and we also touched on this subject. So the subject with the NHI is starting to become a hot potato. In terms of the new regulations, all healthcare practitioners must apply for a certificate that will enable them to practice. Following this, healthcare practitioners will then be prescribed where and how they may practice. Let me repeat that. Healthcare practitioners will then be prescribed where and how they may practice. Let me assure you, the brain drain when it comes to good qualified doctors in South Africa has just hit the fast forward button. There's going to be a huge exodus of good doctors from South Africa when they start getting told where and how they can practice. Solidarity argues that these prescriptive regulations infringe on both the rights of practitioners and patients and are therefore unconstitutional. Furthermore, it will severely restrict the provisions of healthcare services, it said. Kruger said, "This certificate is nothing less than the effective takeover of healthcare practitioners' practices." He is the head of the professional guild at Solidarity. He went on to say, by subjecting healthcare practitioners to these regulations, it forces them to surrender themselves to the state and to only practice as pawns, as and where prescribed by the state. He concluded by saying, these regulations are blatant exploitation of knowledge and skills to drive the state's own agenda. This is detrimental to healthcare practitioners and patients whose constitutional rights of freedom of profession and freedom of association are not acknowledged. Now, let's remember that Open Society Foundation are, I'd put money in it, the people who actually drew up this bill, because they're drawing up just about every other bill that the ANC are bringing to Parliament. So the actual policy of South Africa is not driven by the ANC, but by George Soros. That's the bottom line. This is not a democratic country anymore. Let's continue. According to Solidarity, the government is trying to pave the way for the eventual implementation of the proposed National Health Insurance, or NHI, through these regulations. The state also requires through the NHI bill that state departments and local authorities must approve the practitioner and their activities and requires that healthcare practitioners specify who they will serve and accommodate within their practice. Kruger said, "It is absolutely ridiculous that a healthcare practitioner cannot decide for themselves how they want to practice and that they must be prescribed which patients they may treat. They must be prescribed which patients they may treat." So, now that they're going to allow traditional healers to be doctors under the NHI, if you live in Santon, you might have a witch doctor or a Sangoma treating you. Think about it. This is how ludicrous the whole thing is. It cuts across the cultural norms. It's ridiculous. Anyway, Kruger went on to say, "The practitioners are basically subjected to forced labor that only enables them to practice according to the prescriptions of the state. They will no longer have any control over the nature of their practice, leaving our healthcare practitioners completely in the hands of the state, which then decides whether they may practice or not. This is something we cannot allow." Kruger said the implications for medical care and the medical profession are far-reaching. He said, "The state does not have the ability to control the entire medical profession in the country. They do not have the skills or financial resources. That's why they want to plunder the private health insurance funds." Kruger concluded by saying, "We have already seen during COVID-19 the extent to which the state's incompetence and corruption extends. We must do everything in our power to stop the further takeover of the entire medical industry by the state." And of course you have to look no further than Zweli Mkhize and Digital Vibes. Yeah, that company that was given hundreds of millions of rands to do absolutely diddly squat, and one of the benefactors was one of Mkhize's family. Incredible. But this is how the ANC run or steal and loot from the country. Please remember to subscribe to Loving Life on YouTube to be kept informed. Please remember to register on lovinglifetv.com to be kept informed. That's the platform we're transitioning to. Please like this video, please share this video, and above all, please stay safe. Bye for now.